My name is Nicole Loreto, and welcome to Conversations at the Royal. It is my distinct pleasure to interview our President and CEO, Joanne Bezzubetz, on a topic we often hear about but not sure how we can develop. And I'm talking about resilience. But first, let me talk a little bit about Dr. Bezzubetz and the Royal. So, the Royal is a special facility where we serve individuals 16 years of age till the elderly with complex mental health and addiction needs. We operate 4 operational stress injury clinics for veterans, soldiers, and the RCMP. And we are very proud to host one of the most important research and brain imaging centers in mental health in North America. And this is where our clinicians and researchers are conducting groundbreaking research in new treatments in mental health care and addictions. Joanne's healthcare leadership experience spans over 30 years. She leads the Royal and she brings a wealth of experience and innovative and evidence-based practices in mental health and addictions care. She also has a deep appreciation for culture-based care and working with the Cree and Inuit people in our country. Under her leadership at the Royal, clients and families are active partners in the delivery of care, research, and education. Together, they are shaping the future of mental health care, where care is provided where people are at. So, Joanne, welcome to this special series on Rogers TV during Mental Health Week.
Thank you very much, Nicole. What a warm welcome. Hello, everybody.
Well, Joanne, today we get to talk about resilience. And I recall a definition that you shared that has always stayed in my mind. And I think it's a really great way to understand what resiliency means. You once told me that you see resiliency like a race, like a run. So why a race? Why a run? Can you tell us more?
Yeah, I think the image that I was trying to present when I spoke of resilience in that context was similar to a bike ride. And in particular, that, when you go biking in Gatineau Park, for example, you know that you're going to be experiencing some hilly ground. And so you work very, very hard to get to the top of certain hills. And the reward is coming down the hill. And I really view resilience as similar to that experience where as human beings, we put our hearts and souls into our work every day, into our relationships every day, into things that we're trying to achieve. We're thinking about the future, and that's a lot like climbing a hill. And sometimes the hills are bigger on certain days than others, and that's understandable. But at some point in time, you have to come down from that hill. And the benefit of coming down from a hill is that you have a choice. You can either pedal, pedal, pedal hard to come down the hill, or you can coast down the hill. And, to me, one of the aspects of resilience that I think is very important is that recovery phase so that you have the energy, the time, and the psychological strength to tackle that next hill. And the next hill may not be as challenging as the one that you just climbed and crested. It may be easier or shorter, or it could be steeper and shorter, or it could be longer and steeper. You just never know what the future holds. And so resilience is really about giving it your all, as we all do at work, in our relationships, challenging yourself, always growing, and then taking the time to coast and appreciate and look back and see what you've accomplished. So that's the imagery that I was trying to convey when I talked about resilience being similar to a bike race or a bike ride.
I like it very much. And I'm just thinking about that hill. So what goes on in your mind in terms of preparing to go up that hill? Can we kind of explore that a little bit more?
I think that, one of the things that climbing a hill requires is preparation. Anybody that's gone on a lengthy excursion, like a hiking excursion, mountain climbers, you always hear about all the preparation. And in order to be prepared to climb the hill, you have to have the right equipment, you have to have rest ahead of time, you have to think about fueling, and you need a support team. Not always, but when you do need a support team, it's important to recognize that, I need someone who's going to help me with um, packing so that I can be as efficient as possible. I need someone who's going to help me with the technical aspects of my bicycle. Um, and I think it's like that in life as well, that the preparation for the climbing of the hill, or the preparation for daily challenges that we all encounter, um, require a little bit of forethought. And often it's very easy to go through each day just by yourself and with your own thoughts and so forth. But I think what I've learned, especially through the pandemic, is that there are others who are preparing as equally as thoughtfully as you are. There are people like yourself who have experience that they're willing to share with you, and you can really benefit and have save some time and energy and really benefit from those learned lessons. So no matter what your status is in an organization or what your status is in a family, sharing that burden, even just by talking about it, talking about climbing the hill, imagining yourself climbing the hill, using that visualization and seeing yourself being successful, being positive in your approach, really helps with the resiliency. And, I think it's been proven through research that, how we speak to ourselves, how we talk to ourselves, how we communicate with ourselves, and what we say is as equally important as what you might hear others say about you. So the preparation for climbing the hill involves that positive thinking about yourself and the positive self talk as well.
No, I find that very fascinating, and that preparation. So, can everybody, like, how does one start to prepare for something like that? If we want to overcome either a personal challenge, maybe a difficulty at work, is there ways that people can actually consider that preparation, Joanne?
I think using the imagery of sport preparation, or using some of the other imagery of academic preparation, you don't go from 0 to 100 in one fell swoop. And I think what really helps, and there's literature about this, is dividing things into bite-sized pieces and being quite incremental and thoughtful. When you've got a lot of experience in a certain category, you can take shortcuts and you can certainly skip some of those steps. But as a learner, as a beginner, as someone who's fresh in an environment and learning through an experience, there is a benefit into organizing bite-sized pieces so that milestones are met and that they are viewed as success. And so success along the way, or success with some going back or some failure. Um, Failure is equally important. Failure is an opportunity to do something over again based on that failure and having learned from that experience. So I think the bite-sized pieces, Nicole, are really important, and not rushing through either. Now, if you're very experienced and you've got all kinds of time that you've put into going over that hill, 10 times, 20 times, 30 times, you'll know certain things about what you can and can't do. You'll know how to pace yourself and so forth. You can certainly skip some of those steps. But I think for those of us, over the past few years, particularly with the pandemic, it's been such a new experience for everybody. It's been frightening. It's been um, unprecedented. That word is used very often. And it's been so challenging on so many fronts, and we haven't had that experience. And so I think while we were working alongside professionals who were able to guide us and provide the best advice possible, many of us, went through day by day, learning as we went along. And if you just think about virtual uh, office work or working remotely, how all of us, in order to keep going and to continue to be employed and to continue to have something meaningful in our lives, we had to adapt and learn. And resiliency is about that adaptation and learning as well. But you know what they say, all work and no play isn't good for anybody. And going back to my analogy of work, 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 and then coast a little bit, take advantage of a downhill, that's equally important in the workplace. And it's equally important even if you're taking bite sized pieces. You still have to take a break.
And what do you do in terms of taking a break as a CEO? Because you run a large mental health facility. So, what are some of the examples or some of your self-care activities?
I do enjoy being out in nature in particular. And there's, um, there's something truly amazing about being with nature. And I think there's so much compelling evidence these days about the benefit of being out in the elements. And consider, the luck that we've got here in North America having four seasons, or sometimes four seasons in a day. But being able to experience those four seasons and getting out in nature, like that's one way that I look forward to unwinding. And usually, what I'll do after work is I first thing I'll do is take my dog for a walk, and I know that I will not be walking with purpose. I will be walking, you know, for the dog's benefit, and taking my time. And it's almost like being forced to stop and smell the roses. And it's outdoors, of course, and it doesn't matter if it's raining or snowing or hailing. That walk is going to occur. So I think on a personal level, that really slows everything down after a very, very busy day at work. And while I'm not completely 100% alone, I am alone with my companion, but I am taking time and I'm just reflecting and thinking through the day. Some of the other recreational activities that I really enjoy are cycling, of course, because that's part of the training that I do as an emerging triathlete. I wouldn't say that I'm a very, very experienced triathlete, but I've done a few and I look forward to a few more. And so, having the opportunity to move my body, to connect with others. The other day, I had the just the great luck of bumping into a colleague from work, and she was running as well. And we joined each other and we ran together for maybe 2 or 3 kilometers. And I have to say, it was the most joy that I've had in several months because I was sharing this outside experience with somebody else. Um, I think the pandemic has had a terrific impact on many of us in many, many ways. And we've been introduced to solitude in a way that, for some of us hasn't been welcomed. It's been foisted on us as a society to, really limit our contact with other people and so forth. And I think now that we're able to more safely engage, but still thoughtfully and respecting distances and so forth, that we can be reintroduced to some of those experiences that are very joyful, very rewarding, and on a large scale of things, they don't cost a lot of money. Spending time with someone that you enjoy being with isn't very taxing. It should be very energizing, and it most likely is. So those are, just some of the things that lately have really recharged me and that I've enjoyed.
No, and just that, listening to you talk about connecting with somebody outside and sharing something. And I think that's very powerful because we've kind of lost that. It made me even think about the Run for Women, because obviously the Royal is a beneficiary in the Shoppers Run for Women. And that's coming up soon, correct, Joanne? Is it sometime in
Yeah,
June?
it's coming up in June, and the Run for Women, it has become a movement.
Mm.
And it's not just a run. It's really truly a community movement. Excuse me. What's really changed with the Run for Women is that family members,
Mm.
husbands, mothers-in-law, everyone is invited. I apologize.
Where's that water when you need it?
I'm talking a lot. Pardon me. So, as I was mentioning, the Run for Women is really a movement and an opportunity to declare quite openly and publicly the importance of mental wellness, and to
Mm.
also declare mental illness without stigma. So I think the destigmatization, the movement to destigmatize mental illness, and that being led by some of our strongest advocates at the Royal and throughout the country, has really, really been powerful. And especially now, I keep going back to the pandemic because that once in a lifetime experience of having gone through a pandemic has revealed that there are many more of us who've had experiences with our own mental health as a result of all of the outcomes related to the pandemic. We may have had some underlying issues in the past, but it really, really surfaced through the pandemic. And we know from some of the data that we collect, namely with our prompt clinic, that many women in particular are reaching out for help, and for many of the clients that we see in the prompt clinic, this is their first time reaching out for help for mental health and substance use disorder support. So they previously would not have been one of the individuals that we would have tracked who would have gone to an emergency department for help. But now they're reaching out to their GPs and they're saying, you know what, I need some extra support at this point in time, and I would like to have access to that. So, Run for Women, the benefit, bringing families together, being okay with the destigmatization, accepting people where they are, celebrating success, celebrating current state, celebrating where each one of us is in our own journey around our mental health or our substance use health, equally important. And, just the acknowledgement that people can be where they are, and if they come to the Run for Women, they belong. They already belong.
No, and you're right. It is a movement, and the fact that people feel connected, wanting to support each other in terms of their mental health, whether they're even their family mental health, because that's something important too, and just being able to think about well-being. And I want to kind of go back to what you said because of the pandemic, because the pandemic has really tested everybody's resilience. Um,
Yeah.
and when you kind of look at some of those definitions, like you shared in terms of that bike ride, because it's always about the capacity to adapt in life-changing moments. And God knows the pandemic was quite life-changing for the globe. And then it's the capacity to try to recover. So when you mentioned about the people reaching out for help, when they reach out for help, they're actually building their resiliency, correct? Or is that something like, because to make sure that people don't separate resiliency and then seeking help, because that should go hand in hand.
Yes, exactly. And, resilience and being able to bounce back and uh, adapting, that all fits in the same category. And reaching out for professional help when you need it. I have to use something really simplistic. And, we, we had a little bit of snow today on April 27th. And I was parking my vehicle and I noticed that the neighbor parked beside me still had their winter tires on. And just to think about decisions that we make all the time about when we're going to call in a professional to help us. Like, I would never dream of changing my tires myself. I go somewhere for that help. I'm still, the driver in my vehicle. I still have control over the speed that I'm driving at. I still follow the rules. I stop at the stop sign. But when I need some help with the mechanics of my vehicle, when I need to understand something, I reach out for that help. And it makes life a lot easier. And it's like other forms of expertise, to, call in the professionals when you need them, and then to be able to take over if you build skills or you gain knowledge through that expert, showing you what to do, but you immerse it as part of what you're going to do in the future. And I think resilience is really about that adaptation and being able to see that you can bounce back, you can be successful. And sometimes you'll be able to do that by yourself. You'll be able to have a really good night's sleep, which actually is probably number one in terms of recovery, restoration, and resilience, getting your sleep. And, the next day have a different outlook and, seeing each day as a fresh opportunity for learning. And I think so many of us, because of the impact of the pandemic, getting back to that again, Nicole, I think you're right. It's had such a global impact that it's been hard to wake up every day without hearing the same news over and over and over again. And for many of us, our technique to deal with that is to commit to not turning on the radio until a certain time, or to switch channels. I mean, we don't want to be like ostriches and bury our heads in the sand. We have to be knowledgeable, but I think there's a fine line between total immersion and losing sight of the important things in our lives, and becoming so preoccupied that you don't see anything else, and having that information but being able to move on and integrate the rest of your life in your daily activity. So the resilience is really about that balance. It's not about being lopsided. Even professional cyclists are not going uphill all the time. And I think we have to take that into account, that even professional cyclists take breaks. Even professional cyclists go down the hills. They sleep. They fuel properly, and we can take lessons from that as well. So I think everybody's going to have their own tailor-made recipe for resilience. It'll be different for everyone. And, I guess my message today is whatever that recipe is for you, that you aren't alone. And if it helps you to know that there are others like you having similar experiences, then that is part of your resilience journey as well, is to seek out those individuals and to share. And I think that's why the concept of mutual aid has been so successful in areas and categories like mental health, substance use health, and other forms. The Run for Women, that sense of community, because it really helps you understand that you can do it alone, but you don't have to do it alone.
Well, that's very, very powerful. And you've touched on something that I want to explore a little bit further. You talked about mutual support, and I know something that's something that you really put in practice at the Royal, working with client and families, and recognizing that lived expertise, because I think that's part also when people are feeling having difficulty overcoming some challenges or dealing with certain stress factors in their life. That when seeking help, it also could include having that peer support. Can you talk a little bit about some of those initiatives?
Yes, peer support has been around for a very, very long time. And what we're seeing now are trends in our mainstream service offerings and specialty services that are really embracing the concept of peer support and really and truly valuing what lived expertise can bring to the table. It's like having a recipe book and being able to follow a recipe, but also having access to someone who's used the recipe and made the cake several times. And they've learned certain things about that cake baking that aren't in the book. And so I liken peer support to that type of thing. That there is something about lived expertise that's very, very unique to the individual, because none of us are exactly alike each other, but we can find people who have more in common with us than people who are dissimilar. And so if you find someone who has commonality with you, someone who has had a similar experience with a certain mental health condition, someone who's been hospitalized because of their mental health, there is a proven benefit to sharing experiences with one another and learning. And in particular, this is part of our strategy going forward, is to truly embed the benefits of lived expertise for clients at the Royal, for patients at the Royal, people who are coming in for an inpatient stay for the therapeutic environment and for access to the multidisciplinary team of psychiatry, psychology, social work, nursing, and so forth. And and having that experience, but also having access to people who were in the hospital and who now are available to offer support and to work with people who are still in the hospital. So that shared lived expertise, I think, is something that we're looking forward to making much more available. Also for families. And so, I think one of the big challenges, and I know this from my own family's personal experience, is, families often don't know what to do or how to start and how to get help for their loved ones. But another family who's had a similar experience can certainly share those experiences with the family that's experiencing it for the first time. And those benefits of those tips, those that listening ear, that compassion that comes with someone who's had a similar experience, very, very beneficial. And it helps families realize that they too are not alone, and that other families have had similar experiences, and that there's hope. And I think this is one of the biggest features that, peer support offers, is that aspect of hope that
Mhm.
there is improvement that's available, staying the course, following a treatment plan, um, finding ways to connect with ongoing services in the community, um, you know, all those things, and having someone alongside you to offer that guidance, very, very helpful.
Well, and I'm glad you touched on hope because as you were talking, I just thought, oh my God, it's that idea that you're not alone. And I know, just the work we did with um, young people, and we had called the program "Is It Just Me?" And when people realized it wasn't just them experiencing either signs of depression or anxiety, and then being able to learn more about mental health, about mental well-being, and then connecting with others. So I think that peer support uh, also fosters hope, and we certainly need hope, particularly when people are faced with important mental health challenges. And I'm just wondering, in terms of the future, because you also have a research institute and a really incredible brain imaging machine, maybe to talk a little bit about that, because I think that's an example of hope for the future.
Mhm. I'm so, so proud of our research institute at the Royal. It's affiliated with the University of Ottawa, as you know. But we've got a range of scientists and clinician scientists. We've got some people who are early career research scientists, we've got mid career, and then we've got some very experienced senior scientists as well. And lo and behold, we do have a brain imaging center. We started out in partnering with community donors in, uh, in obtaining a brain imaging machine. And then we acquired some talent and brought in individuals to provide some leadership and to conduct some science and to do some research. And now we've got a center. I think what's really exciting about the Brain Imaging Center is that it will help to demystify the
Mm.
um, the the mental illness that's in front of us. So, for example, not being able to understand what the chemical changes are in the brain or the body because you can't see it,
Mm.
doesn't help to explain how we might tackle an illness like depression. However, if you can see brain activity and you can measure change in the brain based on certain interventions, and you can see improvement, and you can actually visibly see it through the brain imaging machine, then it gives you some direction in terms of what future interventions might be to help with certain conditions. There's the potential of predictive power. How can you predict a tendency that a young person will be subjected to certain illnesses?
Mm.
In physical health, there are early detectors that will give us some insights into whether someone could be at risk of developing diabetes or heart conditions or other types of physical ailments. But in mental health and substance use disorders, we've we haven't had that same opportunity. We're getting it now, and to look into what the connection is between the biology of the human being and the mental health and the mental well-being and substance use health of that individual as well. So I think what we're going to learn in the future about about the brain and mental illness, about the brain, mental illness, and how we can treat it more effectively, getting it right the first time. That's all very, very hopeful and very, very exciting. And I think it's going to really usher in a very different way of looking at mental illness and at substance use health.
Really looking at the whole person.
Yeah.
So that's in the holistic approach. So very exciting, amazing initiatives at the Royal. And I'm just wondering, just in terms of closing, because I know our time is up. As we enter this mental health week, what would you like to say to members of the public in terms of building and fostering their own resiliency?
Share it. Um, share your experience, share your story, and you share it so that others will share as well. And I think it's part of the destigmatization. It's part of allowing individuals to come forward and to share what otherwise could be viewed as a burden. And you know how that saying goes that many hands make the load a lot lighter. Sharing your own experience with other people is very beneficial, not only for you, but also for the other person, because that gets shared with others as well. And I think, society is ripe and ready for more openness around the critical importance of mental health and substance use health, both of them hand in glove with each other, being on par with physical health, because the whole person is made up of all those parts and pieces, not just the physical aspect. I guess my message around resilience is to share and to be okay with yourself. Thank you.
Well, thank you, Joanne. Thank you for your time. And I'd like to invite everyone to, if you want more information, come and take a look at the Royal's website. There's a series of resources. You're also going to hear some other amazing clinicians and researchers this week. So thank you so much for joining us at Conversations at the Royal.